Well, good afternoon, everyone. Today I'm here to update you on Alberta's fight against the fourth wave of COVID-19 and to announce necessary measures that we are taking to protect our healthcare system, to increase vaccinations, and to slow the spread. As you know, Alberta's healthcare system is being tested like never before. Hospitalizations and ICU admissions have soared in recent weeks, driven largely by folks who've been infected but had chosen not to get vaccinated. Yesterday, in fact, 8 people were admitted into intensive care units across the province with COVID-19, and all 8 of them were unvaccinated. Right now, Alberta's ICU beds are at 82% capacity, with new patients admitted every day. Without significant measures to increase capacity, we would have run out of bed weeks ago. We continue to do everything possible to care for patients and increase capacity to keep caring for Albertans. However, that is only half the battle. We also need to slow the spread so fewer people get sick enough to need hospital care. Let me thank the 220,000 Albertans who have stepped up to get their first dose over the past month, moving us from 78% to 84.5% of first dose coverage. Thanks as well to the 200,000 Albertans who came in to get their second dose of protection over the past month, moving us from about 69% to 75% of the eligible population being fully vaccinated in the past 4 weeks. Today, I am announcing that effective tomorrow, Alberta will be expanding the vaccine rollout in an important way. Starting at 8 a.m., all Albertans who are 75 years of age or older, and all First Nations, Inuit and Metis people age 65 and older will be eligible to book appointments to get a third booster dose of vaccine. We're asking them to book these appointments as soon as 6 months has passed since their last dose. This change is based on the advice of the Alberta Advisory Committee on Immunization, and it means that more than 150,000 Albertans will be eligible for booster shots by the end of October. We're doing this because older Albertans remain uniquely at risk and will benefit from more protection. They're still incredibly vulnerable to ending up in hospitalized or even passing away from COVID-19, and so it's so important to provide this additional protection. We await the analysis and recommendations of both the National and the Alberta Advisory Committees on Immunization with respect to potentially broadening eligibility for booster shots to a wider segment of the population. To bend down the curve, we also need to reduce transmission. The measures that we put in place several weeks ago appear to be having a positive impact. We've seen active cases plateau recently, and they now appear to be declining somewhat, with the R rate last week dipping below a level of 1 for the first time in more than a month. This is certainly encouraging news, but the situation remains very serious. Our cases are amongst unvaccinated Albertans in particular. We see case growth amongst children from the ages of 5 to 11 years of age, especially in regions with low overall levels of vaccination. And that is why, acting on the recommendations of the Ministers of Education and Health, we are announcing new measures today to help to slow and prevent transmission at schools. We're taking action to protect students, school staff, and school communities while supporting vaccinations as the best defense against COVID-19. To do this, we'll ramp up rapid testing, initiate contact notifications, and increase the public reporting that families and many others rely on. We'll also be strongly encouraging schools to implement mandatory proof of vaccination policies for adult staff and visitors. Minister LaGrange will provide more details on these changes in a moment. Alberta has one of the best rapid testing programs in the country. We've deployed or committed millions of tests since COVID began, including using testing at long-term care centers, hospitals, and work camps. These tests work, and they are fast. That's why we'll use them to help protect both staff and students in schools province-wide. We'll start with schools that are experiencing outbreaks and are in under-vaccinated areas, and we'll build from there. We will be seeking 6 million antigen rapid test kits to help parents administer 2 tests per week to unvaccinated children, again, beginning in those higher priority areas, and then as supply permits, expanding that hopefully to all unvaccinated school children. By protecting our young people, we'll help to reduce the spread of COVID-19 in our schools and further into our communities. Finally, a very important note I want to add. This weekend, of course, is Thanksgiving, a time when family and friends gather, usually around the table, indoors at home, to share a meal and give thanks for their blessings. Indoor gatherings last Thanksgiving sparked the second wave of COVID, with cases and hospitalizations surging after millions of Albertans celebrated in close contact with loved ones. We simply cannot afford a repeat scenario, not with this dangerous Delta variant that is still circulating and with our hospitals under such severe pressure. So all other rules remain the same, and if they're followed, we'll avoid the scenario that played out last fall. So my message is simple. Please follow the rules that are in place. To be blunt, no indoor social gatherings are permitted outside of a household for people who are unvaccinated. For those who are vaccinated, indoor social gatherings are limited to 2 households for up to 10 people who are age 12 or older. We are also lowering the maximum number of people permitted to participate in outdoor social gatherings from 200 to 20. I said before that we're making progress in our 4th wave fight, but we risk losing all of that progress and once again putting even more pressure on our overstressed hospitals if Albertans do not respect these critical public health rules over the days to come. Together, we need to do everything we can to help ease the tremendous pressure on our healthcare system. And let us all show gratitude at Thanksgiving for our amazing frontline healthcare workers by limiting social contact, social interaction, and by following these public health rules. So that means being smart and being extra safe. It also means getting vaccinated as soon as you can if you are not yet. Thank you, and I'll now ask Minister Copping to provide more details on the expanded vaccine rollout. I believe Minister LaGrange will then speak to these new measures with respect to schools, and then we'll hear from Chief Medical Officer Dr. Hinshaw.
Thank you, Premier, and good afternoon, everyone. Before I outline Alberta's expanded vaccine rollout, I'd like to strongly support the new school measures that the Premier just announced. This 4th wave is testing us, and we must adapt accordingly. As a parent, I am concerned by the high case rates we're seeing in school-aged kids. It's clear that schools need to be a priority. So I want to thank both officials in my ministry and Alberta Education for working together to take steps to protect schools, including increasing rapid testing and public reporting. I've assured AHS that they will have whatever resources are needed to support this work, and I know they'll be working hard to ramp up in the days ahead. I'd also like to thank AHS and healthcare professionals across the province for their continued dedication in caring for Albertans during this extremely difficult time. I have one priority right now, and that's to help reduce the disruption within our healthcare system. One of the keys to doing that is to get more Albertans fully vaccinated. We also need to adapt as new evidence emerges so that Albertans are getting the best possible protection from vaccines. That's why I'm pleased to announce that Alberta will start offering 3rd doses of COVID-19 to our most vulnerable groups. Starting tomorrow, October 6th, anyone aged 75 or older who received their 2nd dose at least 6 months ago can book an appointment to get an additional booster shot. 3rd doses will also be offered to all First Nations, Inuit and Metis peoples aged 65 and older living on or off reserve, again, as long as 6 months or more have passed since their 2nd dose. We are acting on the recommendations of the National Advisory Committee on Immunization and the Alberta Advisory Committee on Immunization. To avoid increasing pressure on AHS when they're already under so much strain, vaccines will be administered at participating pharmacies and physician clinics across the province. Appointments can be made by using the online booking system or by calling 811. Eligible people who live in First Nations will also be able to access third doses through health clinics on reserve. We're taking this step because evidence suggests it is necessary. With COVID-19 spreading rapidly, we want to give these Albertans and those most vulnerable to severe outcomes the best protection possible. This builds on the booster shots that we've already offered to people who are profoundly immunocompromised and to seniors in congregate care facilities. For the rest of us, the third doses do not appear to be necessary at this time. Anyone in the general population who receives complete 2-dose COVID-19 vaccine series can be confident that they have the strong protection against severe illness and hospitalizations due to COVID-19. Of course, we'll continue to monitor the evidence around the world and adapt our approach as needed. As many of you know, Pfizer has submitted preliminary data to Health Canada on use of their vaccine in those under age 12 and expects to apply for authorization later this month. We are watching this closely, and we're ready to move quickly if Health Canada grants approval. I want to assure Albertans that we'll continue to do whatever it takes to respond to this fourth wave. Now, we know that our low vaccination rate is the main driver of the demands on our hospitals. So I'm very pleased that more and more Albertans are stepping up to get vaccinated. Last month, the total number of first and second doses given was 54% higher than it was in August. That's a real change, and it means that we're not stuck at the current level. 75% of eligible Albertans have now gotten both doses. It's great to reach that milestone, but we need to get that level higher, and we can do it. We can increase the level of vaccine protection that we have as a province, and we can get the pandemic behind us faster. We're still a few points behind the national average, but we're slowly starting to close the gap. But when you look closely, the gap is much larger in second doses. That means there's a big pool of people who have already made the decision to get vaccinated, but haven't followed through with that second dose. We need them to do that. So we're working with AHS, pharmacies, and others to reach out to them with that reminder in any way we can. The evidence is clear. Vaccines are safe and they save lives. And the other thing that saves lives is reducing your contacts and your risk of spreading the virus, especially if you haven't been fully vaccinated. So I want to repeat what the Premier said about the decision to reduce the limit on outdoor gatherings from 200 to 20. We need people to follow this and other measures, and to follow the rules around proof of vaccination and everything else that we have put in place. We need you to do this to protect yourself, your family, and all Albertans. And we need you to do it to help reduce the strain on our healthcare system. I hear every day from AHS about the strain that people are working under and the extraordinary steps our nurses and doctors are taking to care for more patients than they ever had in the ICU. I feel for the patients and families who are having surgeries postponed, and I'm forever grateful to our doctors and nurses and others within our system who are doing incredible work to be able to support all Albertans through this challenging time. Now we need to support them by slowing the spread of this virus. So please follow the rules over the holiday. And if you haven't made the decision to get vaccinated, please talk to a healthcare provider and get good advice. And if you've been putting off that second dose because you haven't had the time, now is the time. Just get it done for yourself and for all Albertans. And I'll now invite Minister LaGrange to provide more details on the new measures to help protect schools.
Good afternoon, everyone, and thank you, Minister Copping. I want to begin by recognizing that today is World Teachers' Day. Despite the challenges of this pandemic, teachers continue to find creative ways to help our students achieve success and feel supported. Thank you to each and every teacher for your guidance, your compassion, and your incredibly hard work. Your commitment to Alberta students has been unwavering, especially since the start of the pandemic. You have made sure that students can continue to learn and are able to reach their full potential. Thank you, thank you, thank you. You have my full support and gratitude for the work that you do each and every day. I'm here alongside Premier Kenney, Minister Copping, Dr. Hinshaw, and Dr. Yiu to announce new actions that will further protect students, school staff, and school communities, and keep students learning safely in person. This fourth wave has made things challenging, especially for families of children who are not yet eligible for the COVID-19 vaccine, and certainly for our schools. We have always committed to monitoring the pandemic and to making changes as needed to ensure in-person learning can continue safely. Now, with the fourth wave, we are in a very different situation than we were just a few short months ago. Today, I am sharing additional details that the Premier outlined earlier. First, with the support of Alberta Health Services, we are initiating contact notification in schools across the province in a phased approach. School authorities will support an interim process for contact notification. This will begin after Thanksgiving on October 12th. We will be supporting school authorities as they determine close contacts of individuals who were infectious while attending school, and they will notify families of those close contacts. To help schools through this interim step, we will provide new guidance and share more information on alberta.ca/return to school. Over the long term and by mid-November, AHS will take over notifying parents of contacts within school settings. School authorities will help this AHS team to identify close contacts and will focus on school-based exposures only, such as identifying classroom contacts and close contacts through participation in school sports or extracurricular activities. Contact notification will not extend to positive cases, community activities, or out-of-school contacts. Turning to public reporting. Starting tomorrow, October 6th, Alberta Health will publicly report the name of each school with at least 2 COVID cases. I want to thank Minister Copping and his department for their work to provide families with this important information. Parents and guardians will be able to go online and see if their school has cases just as they did last year. Once 2 or more cases are reported in that school. COVID-19 outbreaks in school settings will now be reported at 10 or more COVID cases within a 14-day period that were infectious while at school, rather than reporting any respiratory illness or gastrointestinal illness outbreak with a 10% absenteeism due to illness. When AHS takes lead for contact notification, we'll see online reporting updated with the addition of an online map for alerts and outbreaks in schools. And there is another critical tool available, at-home rapid test kits. In kindergarten to grade 6, we will offer a targeted rapid test program for schools experiencing outbreaks of 10 or more cases of COVID-19 that were infectious while in school. This will give us another way to protect our youngest children who cannot yet be vaccinated by offering a screening tool for individuals who are asymptomatic. Every student and staff member at these schools will be able to access tests for free if they want to take part. This will give peace of mind to students, to families, and to staff. Parents will obtain testing kits from their child's school, and they will also be able to administer them to their children at home. These tests are fast and easy and will give parents more confidence sending their children to school. As a mother and a grandmother, I know that parents and guardians will have many questions about this program, and we will be answering those questions as we roll out the program later this month. I'm also reiterating the government's support for proof of vaccine policies, something that Premier Kenney announced on September 30th. I strongly encourage every school authority to require proof of vaccination or a negative PCR or rapid COVID test for all adults who enter a school, including staff. Minister Copping and I will be sending a joint letter to school authorities this afternoon, and we will be posting this communication online for Albertans to see. I want to be clear, this does not include students. A school authority cannot deny students access to education due to their immunization status. But I do hope that everyone who is eligible gets their vaccination as soon as possible. After all, vaccines are effective, they're safe, and they are saving lives. They also protect those around us, including children under 12 that cannot yet be vaccinated. Please, if you have not had your shots or know someone who is unsure, speak to a health professional right away. Our school immunization program for students and staff is still running, and it is even open to parents where there is enough supply. In a school setting, vaccination helps to support all the other important measures that are in place, such as enhanced cleaning, distancing, cohorting for grades K to 6, masking for students in grades 4 and up and all school staff, and of course, staying home while sick. These practices keep our schools safe for in-person learning, which is so vital for our children. It is why I commend our schools for everything they do every day to keep our students learning. And it is why we are announcing these important new steps. And on that note, I want to reiterate my thanks to Alberta Health and Alberta Health Services for their support. And mostly, from the bottom of my heart, I want to thank each and every one of you in our education system for all that you do each and every day. Without you, our children could not learn in the safe environment that they are learning in. So thank you to all, and I'll now pass it over to Dr. Hinshaw for today's update.
Thank you, Minister, and good afternoon, everyone. In the last 24 hours, we have identified 663 new cases and completed about 8,000 tests. Our positivity rate was about 8.8%. That is good news, but we must continue to watch closely as a single day's numbers are less important than overall trends, and the coming days will be critical to determine what those trends are. Currently, 1,094 people are being treated for COVID-19 in hospital, including 252 in the ICU. I am saddened to report that 26 more deaths were reported to Alberta Health in the last 24 hours. My condolences go out to their loved ones and to anyone who has lost a friend or family member during this difficult time. I would like to briefly provide a few more details on COVID-19 spread in schools. As we all know, cases have been rising for the past several months. While this has impacted all ages, we have seen the highest age-specific rates recently in school-aged Albertans. While the majority of all of our cases are still in unvaccinated adults, currently those between the ages of 5 and 19 make up about a quarter of our active cases. To be clear, children who contract COVID-19 are still at a much lower risk of severe outcomes than adults. As of October 3rd, only about 1% of COVID patients in hospital are under 18 years of age, and less than 1%, only about 0.8% of ICU admissions are in youths. I do not say that to minimize the risk, as the percentage does not matter to those who have a loved one in hospital. However, it is important to reassure parents that even with our current numbers, there is a low likelihood of children becoming severely ill. We do know, though, that children can spread to others around them who may be susceptible to severe illness, including those in households. The current rate of high case rate requires special measures to help reduce transmission. We are focusing on schools right now because of the sharp rise in school-age cases and the challenges involved in preventing transmission. Childcare and daycare centres have always had COVID-19 outbreak notifications to help operators and parents support and protect these smaller groups of children, and these processes remain in place. By introducing contact notification and public reporting in school settings, in combination with measures that are already present in classrooms, we now add new layers of protection to help bend down the curve and keep kids safe in the days ahead. This is why, as you heard, we are moving back to a case-based definition for outbreaks in schools. As Minister LaGrange announced, any school with at least 2 cases of COVID-19 who were infectious while in school will be listed online, and parents will be informed directly if there are cases in their children's school. Any school with 10 or more cases of COVID-19 who were infectious while at school during a 2-week period will be declared an outbreak. These schools will be listed on alberta.ca starting tomorrow. As you heard, we will also be providing an updated map similar to what we had last year in the next several weeks. While we are taking these steps to best support classrooms and in-person learning, the #1 way we can ensure children are protected is through vaccines. Right now, we have access to safe and effective vaccines, but only about 65% of youth aged 12 to 19 are fully vaccinated. As you know, we have been holding vaccination clinics in junior and senior high schools to improve accessibility, and we need to do everything we can to get these numbers higher. I encourage every parent and guardian to arrange to have their child fully immunized as soon as possible. This will not only help them have individual protection, but it will also help us protect our community, including children 11 and under. Another change we are making today to protect our communities is, as the Premier announced, the restriction on outdoor gatherings has dropped to 20 people, and indoor gatherings are still not permitted for those who are not vaccinated. Even if everyone in a household has both doses of vaccine, indoor social gatherings must be limited to no more than 10 people, but the fewer people, the better. I know asking people not to gather in big groups at Thanksgiving will be disappointing to many. That's why I would like to end by talking to anyone who feels that since they are only one person, they are wondering if their choices really make a difference. You may be seeing others breaking the rules and think, why should I follow these measures if other people aren't? I want to tell you today that you matter. Every person's actions can potentially lead to a chain of transmission that can cause death, hospitalization, or long COVID, perhaps in someone you don't even know. Your actions could also prevent or stop a chain of COVID transmission, which means you have saved lives and protected the healthcare system currently in crisis. You also matter because people are looking at you and may use your actions to justify their choice to break the rules, or they may be encouraged to follow the rules because they see you setting an example. Simply put, you matter. This coming weekend for Thanksgiving, I am asking you to not just meet but exceed the rules that we have in place. Show your care for your family by having a small gathering, preferably outside. Don't have any indoor gatherings unless you are 100% sure that everyone is fully vaccinated, and even then it must be no more than 10 people 12 and over from only 2 households. Do this for yourself, for your family, or if you need more motivation, do this for the healthcare workers who are giving every ounce of their energy to caring for people in critical condition, telling family that their loved ones have died, and struggling to keep the healthcare system running. Your actions have never mattered more, and they will make a difference. Thank you, and Dr. Yiu will now provide an update on the healthcare system.
Thanks, Dr. Hinshaw, and good afternoon, everyone. Every single staff member and physician at Alberta Health Services is focused on providing care to anyone who needs it as soon as we possibly can. This is a key tenet to the working of healthcare professionals, ensuring that our patients are looked after and that we provide them with the necessary treatment and care in a timely manner. This is true of emergency and urgent surgeries, just as it is true of more minor ailments and procedures. We know that any delay is life-altering and can cause unnecessary anxiety, stress, and frustration. That is why having to postpone surgeries and procedures is an extremely difficult and heart-wrenching step for us to take. However, it's been a necessary step each time COVID case numbers and hospitalizations have swelled from the first wave to this current fourth wave. I'm well aware of the deep and lasting impacts a delayed surgery or procedures can have, and I'm very sorry to all Albertans who have had their surgeries postponed at this time during this pandemic. Throughout this fourth wave, we have done all that we can to limit the impacts of surgical postponements as much as possible. Since the end of August, AHS has had to delay or postpone approximately 8,500 surgeries provincially. This includes 805 pediatric surgeries. During the same time, we have also completed 9,100 surgeries, including 3,500 emergency surgeries and 1,100 cancer surgeries. This means that despite planning for postponement of up to 75% of all surgeries, our teams have managed to complete more than 50% of surgeries in the past 3 weeks. This is a testament to our amazing teams who have, despite responding to unprecedented COVID numbers in acute care and ICU, also managed to perform as many vitally important procedures as possible. We are carefully increasing our surgical activity when COVID demand allows. For the past 3 weeks, we have been performing any emergency surgery that has to be completed within a 3-day window. We will continue to do that, but we are also slowly expanding when COVID demand permits us to be able to, so that we can now perform urgent cases that have to be completed within a 28-day window. We're also expanding the number of cancer surgeries being performed. This is dependent on critical care staffing and resources and inpatient and ICU capacity required to continue to support the ongoing urgent pandemic response. We will continue to be cautious because, as we've said before, it's a fragile balance to ensure we have available ICU beds for anyone who needs one. We will continue to reach out to patients to let them know if their surgery timeline changes, and we will continue to adjust our plans as COVID-19 numbers fluctuate. We're able to increase our surgical capacity because, in part, pressure in our ICU has eased ever so slightly, and this is likely due in part to Albertans following the public health restrictions and getting immunized. This is very positive, and I really want to thank everyone who has decided to be immunized and for all Albertans for doing their part. This morning there were 307 patients in ICU, including 252 patients with COVID-19. ICU numbers remain at near record highs. We currently have 374 general adult ICU beds open in Alberta, including 201 additional spaces. Provincially, our ICU capacity, including these additional surge beds, is at 82%. But without the surge beds, our provincial ICU capacity would be at 177%. Once again, I would like to thank our frontline teams for their tireless work in caring for Albertans. And I got to see some of this firsthand when I went and toured the ICU at the Royal Alexandra Hospital in Edmonton. Staff at the Royal Alex have expanded their ICU from a baseline of 25 beds to 43 spaces, including additional surge capacity. This included converting a surgical recovery room and a pre-admission clinic into ICU spaces. It was sobering to see physicians and staff caring for patients in these areas which were never intended to be ICU beds. The situation is playing out at most of our big urban hospitals across Alberta, and it is something that I never thought that we would experience. Nor did I ever think that we would need help from the Canadian military, and yet tomorrow, 8 Canadian Armed Forces nurses will begin orientation at the Royal Alexandra ICU. We also have nurses coming from the Canadian Red Cross who will be supporting care teams in Red Deer and some of our rural facilities, And this weekend, we expect to welcome a team from Newfoundland and Labrador who will help support Northern Lights Regional Health Centre in Fort McMurray. Seeing this gracious response from outside of our province makes me extremely proud to be Canadian. This is truly a national effort, and I'm deeply grateful for the help that is coming our way. The support will help to ease pressure on our hospitals and on our exhausted frontline physicians and staff, and it will help ensure that we have the ability to care for Albertans if and when they need it. You can also do your part. The best way to reduce the pressure on our hospitals is for every Albertan to get immunized. Getting vaccinated protects you against COVID and protects your loved ones, your communities, and your hospitals. There are still plenty of opportunities to get immunized. Please book online or call 811 and make an appointment. The vaccines are safe and effective. In fact, they're much safer than what some people are touting as an alternative. We've seen increased claims about ivermectin in the past week. Ivermectin is not a cure for COVID-19, nor is it an effective or safe treatment for people with the virus. Neither the veterinary nor the human drug versions of ivermectin has been deemed safe or effective for use. And use of this version of the drug to be used in the veterinary settings can pose seriously health problems if consumed by humans. There is a lot of misinformation about COVID-19 out there, and I strongly encourage all of you to do your research using evidence-based, well-regarding scientific sources. Don't believe everything you read or see on social media, and if in doubt, reach out to a healthcare professional or call 811. It's difficult to believe that we're heading into another long weekend and a Thanksgiving weekend while still dealing with very high cases of COVID-19. And last year we saw a spike in cases after Thanksgiving, largely caused by people coming together to mark the holiday. This is understandable. We yearn for human contact, particularly during this difficult time when case numbers are so high and yet necessary restrictions are in place. We all need to ensure that this doesn't happen this year. Our hospitals and our frontline teams do not have the capacity to handle another significant spike in cases. Please follow the public health restrictions, limit contact with people outside of your household, don't socialize if you're feeling unwell, and wear a mask. We have made some progress in reducing pressure in our healthcare system, but that was not without a price. And I thank you for all of you for your sacrifices. Let's make Thanksgiving a safe holiday, and let's all continue to support one another. Thank you.
Thank you, Dr. Yiu. We will now open it up to our Q&A portion of the news conference. We will have questions in Calgary, Edmonton, and on the phones today. So if you have a question in the room, please just line up at the microphones. We'll start with the phones. Operator, can you please put through our first caller?
Lisa Corbella, Post Media.
Good afternoon. This question's for the Premier. We're only 13 days away from the upcoming municipal election, and the province has two provincial referendum questions on that. And I'm hearing from quite a few readers arguing that the province has got both questions wrong. Most Albertans, for instance, are not opposed to equalization in its entirety, just maybe in its unfairness to primarily Alberta. And few Albertans, it seems, want to eliminate equalization in its entirety, and yet that's what the question calls for. On the issue of daylight savings, experts in this field say that the question itself is wrong, and if Albertans vote yes to moving to permanent daylight savings time, that would be the very worst outcome for the health and safety of Albertans. So according to sleep experts, and I've spoken to one, messing with our clock and locking onto daylight time permanently will lead to more accidents, less productivity, more cancer, more heart attacks, more obesity, and more diabetes as a result of delaying sunrise in the winter. So, the proper question would actually be, should Alberta move to a permanent standard time or natural time? So I guess my question is, are you going to look at this and change these questions before it's too late?
Well, Alicia, there have been widespread, expansive consultations on both of these matters leading to these questions. First of all, we committed to Albertans to hold exactly this question on equalization in the last election campaign. It was, I believe, one of the most popular platform commitments that was endorsed by Albertans. And we further asked the Fair Deal panel to consult with Albertans on the right question to advance equalization reform, and this is the question that they recommended. We have seen in polls supermajorities supporting this question. The point of it is to get leverage for constitutional negotiations with the federal government about reform of the entire system of fiscal federalism which treats Alberta so unfairly. We've been clear about that from day one. This is about getting leverage, and it's about using a constitutional referendum as opposed to just a regular political mandate to force those kinds of negotiations, to give us real leverage in fighting for not just equalization reform, but reform of the fiscal stabilization program, additional funding under the Canada Health Transfer. And one of the most important aspects of this, of course, is to respect Alberta's jurisdiction over our economy and our resources in opposing, for example, Bill C-69. So we've been very clear about this since 2018 that this was our intention. In terms of the question on daylight savings time, again, there were widespread consultations led by Service Alberta last year. I believe that over 90% of those who completed surveys, which it was tens of thousands of people who responded, over 90% of them endorsed the recommended approach. We are very carefully proposing an approach that would align us with our surrounding jurisdictions in this part of North America. Alberta is not an island. But we have British Columbia has decided to do this. We would be aligned with Saskatchewan. Yukon is moving forward in the same direction. The state of Washington, the state of Oregon, the state of California are all moving in this direction. And so we can't be, I think it would be imprudent for Alberta to go in the opposite direction from all of the jurisdictions in our part of North America. Now, this wouldn't necessarily mean immediate implementation. We would want to carefully watch what our neighboring jurisdictions are doing, ideally to go in tandem with them. But the option on the ballot is what we've consulted Albertans on. This is a final chance for them to have a say, as they did, I think, twice in the 1950s on this issue. And again, to do so in a way that would align with our neighboring jurisdictions.
Alicia, do you have a follow-up?
Yeah, my understanding, though, and looking back at what you said when you were running in the last provincial election in which you won, was when you talked about the equalization, you weren't talking about scrapping equalization, you were talking about getting a better deal. And that's not what this question says. So it doesn't seem that this is the idea that you've had out there since 2018.
No, the platform, you can look it up online, it's still there. Alberta Strong and Free very clearly commits to a referendum on Section 36 of the Constitution, which is the principle of equalization. I've always said that I think the majority of Albertans support the concept of helping our fellow Canadians when times are good here and they're not good elsewhere. But we want to trigger negotiations on equalization and the broader question of Alberta's role in the Federation. So this is exactly what we committed to do. We're keeping our commitment.
Operator, can you please put through our next caller?
Matt Woodman, CTV.
Hi there. My question is for the Premier and the Health Minister. The Alberta Medical Association sent you both a letter, and it's asking both of you, quote, "We urgently need you to come see what we're experiencing. We would like to formally invite you to come visit an Edmonton area ICU as soon as possible to see it for yourself." So will you and the Health Minister be accepting this invitation to visit an ICU?
Well, appreciate the letter. I have not seen that yet. These are Government of Alberta hospitals, and I'm always very careful not to politicize the hospitals. We don't do photo ops and bring. In fact, we strongly discourage people from who are don't have to be there for clinical purposes from going in the hospitals. I'm acutely aware, speaking to physicians all the time and other healthcare workers, about the extreme stress that they are under. I've done videos to present to the public the kind of extreme stress our ICU nurses and clinicians are facing. I speak to that at this microphone constantly, and Albertans need to understand the extreme pressure that our frontline healthcare workers are under, which is exactly why we have taken extraordinary measures. For example, bringing in the proof of vaccination restriction exemption program, banning indoor social activities for people who are unvaccinated, limiting indoor social activities for vaccinated people to 2 households and no more than 10 people, bringing in strict capacity limits for a wide range of social and economic activity, including the exercise of the constitutionally protected freedom of worship, a province-wide mask mandate, the mask mandates and other safety protocols that have been brought into schools, and many, many other measures. Thankfully, with the rate of transmission now coming below 1, and we've seen the numbers appear to be trending in the right direction, but in terms of cases, but we still have far too much pressure on the healthcare system, which is why we are making an urgent call to Albertans to respect and comply with the public health measures as we approach the Thanksgiving holiday. It's also why we're taking these additional measures in the schools, and it's why we continue to do everything possible to drive up those vaccine numbers.
Matt, do you have a follow-up?
If the health minister could answer that question as well, because the invitation was extended to both of them. Thank you.
Thank you for the question. I'll reiterate much of what the Premier has said. Just received the letter. I fully appreciate and even though I'm not on the front lines, speaking with Dr. Yiu and the Premier and other cabinet ministers, quite frankly, on a daily basis, to understand the capacity and the constraints that we have. I hear the doctors and the challenges that they have. Again, going into a hospital at this juncture in time, it may not be appropriate because it'll interfere with the important work that they're doing. That said, we hear them. We're listening, working with Dr. Yiu, and I've reached out, for example, Dr. Park, in terms of the letter to me and invited me to come down, reaching out to him to actually set up a call with him when it's appropriate for him, because he's actually very busy with this, to hear firsthand from him and understand that our system is under incredible duress, and that is why we're making the changes that we announced weeks ago, the changes that we're announcing today, and continue to watch this very, very closely.
Operator, can you please put through our next caller?
Rick Bell, Calgary Sun.
Good afternoon, Premier. Just a question and a supplementary. The first question is, because I'm a bit confused, what is your message today on assuming Albertans follow the rules that are in place? Do you believe the worst is over? Do you believe we reached the top of the sort of case peak and that we're on the way down? Do you believe, what do you think of those people who are saying we're in a terrible crisis and are advocating for further restrictions or lockdowns? So I just want to get a sense of where you're at with COVID.
Sure. The message is really two things. One, thank you, and two, be careful. Thank you to our healthcare workers. Thank you to the nearly 250,000 people who stepped up to get protected by vaccines in the past month. Thank you to folks who have been following these wide-ranging public health measures that we have in place. Thanks to your collective efforts, we appear to be making some progress. But please be extremely careful, because the pressure on our healthcare system remains unsustainable. We can't maintain this pressure on our frontline workers at this pace indefinitely. So the fact that we've made some progress in so far avoiding a worst case scenario and seen some encouraging modest trends in the right direction by no means suggests that we are out of the woods, because as Dr. Yiu said, we continue to have typically around 300 patients in intensive care. That's about 180% of our baseline capacity, and it's only sustained by widespread postponement of surgeries and other medical procedures. So I don't think that's a complicated message, Rick, to say on the one hand, people have been pulling together, we have been driving up the vaccination rates, and there have been some encouraging numbers. But we've really got to push the curve down. We've got to push it down so that we relieve the pressure on the hospitals. That is the most important message. And it is more important now than it has been in a long time because of the Thanksgiving holidays. That's a core message here today. If people think that, oh, we've got a couple of good days on the numbers and things don't look quite as bleak as they might have 2 weeks ago, and therefore we can all get together with extended family and friends and have a great party this weekend, that would be exactly the wrong message for people to draw from these numbers. If we have, if millions of people get together like it's a normal Thanksgiving in intimate indoor family gatherings at homes, and especially folks who are unvaccinated, we will likely see all of the progress that has been made lost overnight. And we could see a significant spike back up in cases. So just to keep it really simple, thank you, but please be careful. Please do the right thing. Please don't risk the progress that we've made over the past couple of weeks.
Rick, do you have a follow-up question?
Yeah, it's a very quick one. It's sort of a quick two-parter. First one is answering the second part of my last question, which is, what do you think of those people advocating for still advocating at this very second for stricter measures, including possible lockdowns? And the biggie, how do you plan to restore trust in your government and in its approach to COVID, given what has happened in the recent past before the fourth wave, leading to the fourth wave, and throughout the fourth wave? So how do you plan to restore trust in your government's approach when there's a lot of people who don't trust the approach? And number two, what do you think of people, or what do you think of the position of advocating for more measures?
Well, I respect that people have strongly held views on the right thing to do. As we know from the beginning, there's been a real polarization of those views here in the province. We listen respectfully to all of the different views. We look very closely at the data. We listen to public health advice, and we make the decisions that we think are most appropriate to protect our healthcare systems, protect our hospitals in a way that is realistic. By which I mean that the single greatest likely cause of transmission as we head into Thanksgiving in the fall would be indoor social activity amongst folks who are not vaccinated, which is not permitted. So really this comes back to 4.5 million Albertans, particularly the few 100,000 who are unvaccinated. Our future and the capacity of our healthcare system is ultimately in their hands, as Dr. Hinshaw said, the hands of every individual in the choices that they make. We're trying to inform those choices with clear public health measures, and I desperately hope that those Albertans will listen and take this very seriously. All we can do as government is make the best decisions that we can based on the circumstances that we are facing. When we introduced a series of wide-ranging public health measures last month, we did so because we had to. We had to bend down this fourth curve. There is some encouraging data to say Albertans are rising to that challenge, but we have a long way to go yet. So really, this comes down to the decisions that Albertans will make individually. We hope that when they make those decisions, they'll be mindful of the often heroic work being done in the front lines of our hospitals. And as I said, the best way that they can give Thanksgiving is to act carefully over the days and weeks to come.
Operator, can you please put through our next caller?
Ashley Joanno, Post Media.
Hi, these are questions for Dr. Hinshaw. In your September 23rd briefing, you said that because of the current restrictions that exist that don't require close contact to self-isolate, doing something like contact tracing in schools would violate privacy concerns. I'm wondering what's changed and whether students who are close contacts will now be required to self-isolate.
Thank you. Yes. So in order to facilitate the change, we will be implementing a CMOH order that requires an entire classroom of children. If there are 3 or more cases infectious within a classroom in 5 days, then that class will need to be moved into online learning for 10 days time period. And so we will be initiating an order to facilitate the contact notification process that we're putting in place. And we are focusing on schools, as was mentioned earlier, as a location where, particularly in that younger age group, you have those groups of kids who are not yet able to be vaccinated coming together on a regular basis. And so we are really focusing the contact notification on that location. And we are using again, the fact that we need this extra level of public health protections and the interventions that we're going to be putting in place built into a CMOH order for public health purposes. And so that is the framework under which we're doing this particular change.
Your follow-up, Ashley?
I do, thanks. So I believe it was last month you gave a presentation to doctors in which you talked about how complicated it would be to ramp back up contact tracing. Essentially, your argument, if I understood it correctly, was that you would need a certain amount of manpower and Alberta needed those resources elsewhere. I appreciate that this isn't a full ramp up, but can you give me a sense of how many extra people are going to need to be hired to do this level of contact tracing and where those people are coming from?
Sure, and that's accurate that one of my concerns with respect to resuming contact tracing in all settings is the number of healthcare professionals that would be required to support that effort, and the fact that right now it's all hands on deck to support acute care, and we know that in some instances public health nurses are needing to be deployed into acute care settings to support that particular effort. I don't have the specific number of individuals who are going to need to be recruited within AHS, but it's my understanding that they will be using the model that they developed previously, which does require some healthcare professionals working with others who are not healthcare professionals in a team model to try to minimize the impact that has on the healthcare workforce. And again, focusing on schools in particular, as we have seen over the last several weeks, that 5 to 11 age range has the highest age-specific case rate in the province. So again, it's still important when we're looking at contact tracing broadly to recognize those trade-offs. But at this point in time, we want to utilize those resources in that team-based model to be able to support this additional effort in schools to further minimize transmission in those locations.
Thank you. Operator, can you please put through our next caller?
Emily Mertz, Global News.
Hi, thanks for taking my question. It's for either Minister LaGrange or Dr. Deena Hinshaw. I'm just wondering why there is a month delay in putting in the support for schools in terms of contact tracing or contact notification, as I understand we are now calling it. Why are you leaving it up to the responsibility of schools until mid-November when many boards are telling us that they need that support now? Is it, as we just talked about, is it a staffing constraint issue?
Maybe I'll start, and then Minister LaGrange, if you have comments. So one of the things that you may recall I spoke about a week or two ago in an availability was the fact that we were looking closely at what kinds of additional measures might be needed in schools. But because we had shifted our model in the summer to move to focusing on isolation for cases and doing self-notification cases of their contacts, that we had redeployed staff at that time. And so it was important that when we looked at making a shift and what shift would be right for school settings, that we looked at that resourcing and we had the time frame and we worked with partners to make sure that all of those pieces were in place. It will take 4 to 6 weeks to hire back the healthcare staff to be able to have healthcare resources to do the contact notification in a school setting. And so it was important to be able to work to figure out what those interim processes would be. And so again, the exact framework of what the public health interventions would be, how the notifications would work, how the reporting would work, how we're going to implement test processes, all of those needed to be detailed before we could bring that forward today. So that's, again, all of those pieces that we were putting in place to be able to speak about this today, and there will be that interim process followed by shifting to a health-led contact notification once that recruitment has been finalized.
Thank you, Dr. Hinshaw. And I'll just add to that, given the fact that, as Dr. Hinshaw said, it is not that easy to just flick a switch and start contact tracing. Again, we are going to have contact notification starting next week. And so within our schools, the administrators will be getting information from AHS and then pursuing the close contacts of individuals who are contagious within our schools. Again, only within our schools. And this is very similar to what took place last fall when AHS was looking to ramp up contact tracing, and administrators and school staff had to step in to just do that extra little bit. So we are very confident that with this phased approach, we will be able to return to where we were at similarly, but slightly different than we were at last year.
Emily, do you have a brief follow-up?
Yeah, thanks. I just wanted to see if the minister or Dr. Hinshaw could go over again who has access, which schools, parents and students have access to those rapid tests, you know, what areas are considered lowest risk of vaccination uptake, and then is it outbreak schools, I think you said?
We will certainly start with outbreak schools, particularly in the K to 6 school age range, so that would be for outbreaks of 10 confirmed cases that were contagious within a school setting. And then obviously, as we have more availability of tests, we will expand that program out.
Okay, so I'm hearing we don't have anyone in person in Calgary, so I think we'll take one more from the phones and then we'll take our last question here in Edmonton. So operator, can you please put through our last caller?
Adriana Williams, CBC French.
Hi. My question is for Premier Kenney. I'll ask it in French. Monsieur Kenney, est-ce que vous pourriez expliquer à quel point la sévérité de la situation à l'approche de l'Action de grâce de Thanksgiving et pourquoi vous décidez de mettre en place ces nouvelles mesures dans les écoles?
Oui. So the question was, how would I characterize the current situation as we approach Thanksgiving, and please explain the new measures in schools. Alors, heureusement, nous avons vu une diminution de nouveaux cas en Alberta dernièrement, et j'aimerais remercier les Albertans qui ont agi de façon responsable, et particulièrement de 200 000 qui ont été vaccinés dernièrement. C'est une augmentation importante dans le niveau de la population avec cette protection importante. Mais cela étant dit, nous nous inquiétons sérieusement de la possibilité d'une autre vague provenant des réunions familiales pendant la fête de l'Action de grâce ce week-end. Parce que l'année dernière, on a vu une grande vague provenant de l'Action de grâce. Alors, nous exigeons les Albertans à suivre les restrictions de santé publique, y compris une prohibition sur les réunions sociales et familiales Pour ceux qui ne sont pas vaccinés, ce n'est pas permis. Et pour ceux qui sont vaccinés, il y a une limite de 2 familles vaccinées, maximum de 10 personnes d'âge 12 ou plus âgées. Alors, il faut suivre ces réglementations de santé publique pour qu'on puisse éviter une vague de l'action de grâce qui puisse menacer à nouveau le système de santé. Deuxièmement, nous mettons en place les nouvelles mesures dans les écoles, particulièrement pour mieux informer les parents et la grande public des outbreaks dans certaines écoles. Deuxièmement, on va fournir les parents avec les tests rapides pour COVID-19 pour qu'ils puissent mieux protéger leurs élèves et autres mesures parce que nous reconnaissons que maintenant, nous voyons le plus grand pourcentage des cas est parmi les jeunes élèves qui ne sont pas vaccinés. Alors, ils sont les mesures supplémentaires pour les protéger.
And Andrea, do you have a quick follow-up?
No, I think that answers my question. Thank you.
Thanks. And last question here in the room.
Hi, I have a question for Minister LaGrange, and I'm also hoping the Premier can answer it in French. Sorry, it's Janet French from the CBC. I didn't say that. The Alberta School Boards Association, some school boards like Edmonton Public, Calgary Board of Education, the Alberta School Councils Association, pediatricians, have all been asking for your government to reinstate contact tracing in schools, and some advocates have been asking for rapid tests in schools for at least a month. Now you're here announcing these measures, and the Edmonton Public School Board says, yeah, that was a month ago. We're too late. We need a 2-week shutdown because the situation in schools is so dire. What took you so long to act while so many kids were exposed in school and then went home and exposed their families?
We have always maintained that our first priority is the safety and security of our students and our staff, and that will always be our number one priority. We've been working very closely with Dr. Deena Hinshaw and her team, with Alberta Health, AHS, to ensure that the health measures that we put in place are actually doing what they need to do. We have very good protocols within our school system. We started the year with very strong protocols. Mid-September, when there was a state of emergency, we added additional masking for grades 4 and up and all staff. We've also implemented cohorting for K-6 schools. We've added just recently a strong recommendation for school authorities to have immunizations for all of their staff, proof of vaccination, I should say, and or a PCR test or rapid testing. So all of these measures together are working to keep our schools safe. We will continue to monitor very, very closely. And if additional measures are required, we will absolutely do that. Right now, we have 9 schools that have transitioned to online learning for operational reasons. That's 9 out of 2,415 schools.
Okay, I'll try. There's a lot of content. I'll try in French. Maintenant, il y a 9 écoles de 205. Maintenant, il y a 9 de 2500 écoles qui sont sur l'éducation en ligne à cause des outbreaks, mais nous avons mis en place plusieurs mesures pour protéger les élèves et les personnels, y compris les enseignants, y compris évidemment le mandat des masques et toutes sortes d'autres mesures. Aujourd'hui, nous prenons les mesures supplémentaires à la suite de semaines de travail entre le ministère de l'Éducation et de la Santé, y compris évidemment la provision des tests rapides et un renforcement du système de contact tracing. Sorry, my vocabulary is not great on that.
Thanks. You didn't actually answer my question about why it took so long, though. And I also just have a follow-up for Dr. Hinshaw.
I believe we did answer your question. We have continued to monitor very, very closely as there was a state of emergency in mid-September called. We added additional measures in all grade levels, and we continue to add measures as I've introduced today, and we will continue to do what is required to keep our students and our staff safe. And I'll ask Dr. Hinshaw to come forward for your subsequent question.
For Dr. Hinshaw, I'm still not clear based on what you've announced today whether families, staff members who have an association who go physically into schools have to notify the school. Is it mandatory that AHS tells the school about a case, or that a family that with a positive test notifies, or a staff member that tests positive notifies the school that this has happened?
So with the implementation of the new CMOH order, there will be notification from the health authority, so AHS will notify the school directly when there are cases that have been infectious while in a school. So again, to be clear, when there's an exposure that's happened in a school, where an individual, whether that's a student, a staff member, or anyone who's been physically present in a school while infectious, that notification will happen directly from AHS to the school. So certainly a parent or a staff member is free to also notify the school, but there will be an automatic direct notification, again, supported by a CMOH order for school settings, for that notification to happen independent of the individual notification. And again, that's because we are seeing that schools, as we have been monitoring over the past month, that we have been seeing, especially in that 5 to 11 age range. There is a bit of a differential in terms of the rates there, especially in areas with low vaccination rates. And so we do need to take this next level of measures in those locations. So the notification, again, will be supported by a CMOH order, and the contact notification will flow out from there, initially supported by schools, but AHS, once they have completed restaffing, will be picking that up in mid-November, to be able to do that notification to parents and staff who have been potentially exposed at school.
And that's all our time for today. Thanks for joining us, and have a good evening.